Welcome, everyone, to the Care Right Incorporated podcast about family caregivers and the caregiver crisis that we have with the tsunami of our elderly loved ones aging. My name is Annalee Kruger. I'm the owner of Care Right Incorporated. We work with family caregivers all across the country in helping you understand aging, helping you understand dementia progression, and putting an actual aging plan in place so that you, as the adult kids, don't get thrust into caregiving and then quickly realize how overwhelming that is or how ill prepared you might have been to be a caregiver. Example, dads don't usually want their daughters to give them a bath or help them with the bathroom issues. And so families end up getting thrust into family caregiving, or dementia progresses faster than what the family thought it would, or their loved one just got a diagnosis of cancer and now everybody's like, "Oh my gosh, what do we do?" There's so many decisions that we have to make sooner rather than later. So those are the folks that we work with all across the country. And as you know, I always somehow manage to find the coolest people in the whole world doing other really super cool things that are unique and innovative. And those are the types of guests that I like to have on our Care Right podcast. And today is no different. Today I am interviewing Dr. Elena Rivers. Can you share with us your business and your why? What made you start your company? Tell us a little bit about your background.
First of all, thank you so much, Annalee, for having me. I am delighted to be here. Listening to what you're saying touches my heart because I just came from New York visiting my dad, who's 71. And everything you just mentioned, I was like, deja vu. So thank you for doing this. Thank you for
Yeah.
bringing awareness. And we will soon get there in age, right? And we'll be fully prepared. But thank you again. My name is Dr. Elena Rivers. I am the CEO of Amera. We are a national service of transportation. We're under the umbrella, you could say, of non-emergency medical transportation with a specific niche for day surgery transportation. So I'm the CEO. I've been the CEO of this company for over 12 years. Prior to that, well, I also have a doctoral degree in business administration with a concentration in organizational leadership. So I have a lot of responsibility on my plate with over 3,000 nurses and CNAs across the United States. We're based in Texas, but we're often, filling in the gap of the medical transportation when it comes specifically to day surgery. So that's what we do.
Mhm. There's a lot of gaps in our healthcare industry in literally every single category. And so your service fills that same day surgery transportation gap. Can you tell us a little bit more about what that looks like? So someone goes in and because hip surgery is now like an outpatient practically.
It
And
is.
so how does that work? And how does that work for families that are needing that service? Because maybe mom is in Texas or somewhere and the kids are in New York or somewhere else, and they're like, we can't just fly down there every time mom has surgery or something. How does that work?
Just like CareRide, you are a consultant trying to educate the community of what services are out there. For us, we identified a gap in the medical transportation. We're not necessarily for
Yep.
seniors, but when you say seniors, nowadays it's who needs the service. A lot of our
Right.
seniors need the service, but a lot of people are also independent and they're not seniors, they're almost there. And they need that extra help, that reliability. They don't want to bother family members. For example, for me, my
Uh-huh.
father's in New York. I was there this weekend. I had to catch a flight Thursday afternoon.
Yep.
And I had to sit there and figure out, I'm running a business, but I'm here trying to figure out how do I help them when I'm long distance. So here I am running a business trying to
Right.
solve a problem, and I'm in the problem. Annalee, I'm in the problem. So
Right.
until you know these resources, until you know what's out there, until you know, and I love what you're doing, CareRight is actually giving all those resources to our community, which that's why I said yes to your podcast. So for us, the non-emergency, it's one thing, but the other thing is how do we solve specific problem because not all one size fits all, right? Your needs
Uh-huh.
and my needs, my father's needs, your mother's needs, everybody's needs are unique. And so when we talk about how do we solve a problem, we have to start with what is the problem and that not just generalize it as, okay, this is a problem, this is the solution. We have to be well educated on what are my options. What does insurance look like? If I don't have insurance, what does it look like if it's out of pocket? If it's
Mhm.
not this, it's that. What kind of services can I get? And so for our space in day surgery, the way we identify that is we noticed that Uber was trying to get into that space, but Uber is very general in logistics. I mean, not logistics, I take it back. They're more technical and convenient. We're more hands-on. When someone needs a procedure or someone is going to be scheduled for a procedure, you have to be prepared before that and after. For example, who's going to take you that because you're not allowed to drive? Who's going to sit in the lobby and wait for you? It's not going to be a share ride. It's not going to be taxi. They're not equipped to do that. They're not
Mhm.
trained to do that. They're not even compassionate to do that. And you know this language, Annalee. Compassion and
Yep.
empathy today, it's first is that with safety, right? And so who's gonna stay
Mhm.
there? Who's gonna take care of me? Who wants to take care of me? Not who has to take care of me, who wants to take care of me. So we felt like the nurses and the CNAs are more equipped to want to care and share that, empathy with the patient and relieve the family members. So that's what we do. We tell you, do you need us to stay there? Do you need us to go home with you? We try not to do the assisted living, I mean the nursing home or stay home caregiving. We
Yeah.
try to do that. But we offer the bare basics of at least getting you home and stay monitoring you for 1 hour, 2 hours. And that's it. And then partner with other agencies that can take over after that. Someone who can be there
Sure.
longer than the 2 hours and the 4 hours. And so this is not a one size fits all, Annalee. This is a problem that is here. 30%, National Council for Aging says that 30% of seniors face barriers in transportation. 30% is a big,
Mhm.
right? And so
Right.
then what are we doing about that? How do we fix that? Well, number one, what we're doing right now, we talk about it. Number two, we talk to our policymakers. What are you doing for the seniors, for the veterans, for the vulnerable? Okay. And then how do we partner with insurances? Do insurance understand the need and are they offering this as a service? Or is this a responsibility out of pocket? What is this? How do we help people? Because our voices and our responsibility as leaders of our own companies is to speak for these seniors and to give them a voice that they don't have.
Right.
And guess what? They worked all their lives here and, they worked. And now today comes to, well, this is somebody else's problem. No, it's not. This is our problem. And so
That's
for
right.
me, yeah, right. So for me, the responsibility is first identifying what the problem is, figuring out how we can solve it, and being a voice for our seniors and for the most vulnerable.
Mhm.
Right. And not just that, but
That's
also let's
right.
just remove the seniors. Like I said at the beginning of this podcast, the independence. People love their independence. So, for example, when I get older, Annalie, I'm telling you right now, I'm going to call you because I don't want to bother my children. I don't want to bother my
Right.
children. They have careers, they have jobs, they have this. They don't want to take care of mom and dad. My dad was looking at me like, I'm so sorry that you're here. And I'm like, Dad, don't apologize because I'm here. He was apologizing because I went to him to say, Dad, what's going on? What are we doing? I'm talking to the nurse, to the doctors, to everybody, to my sister. We're communicating over the phone. And my dad's sitting there like, I don't want to do this to my kids. And I'm like, no, you're not
Right.
doing this to us. We're just going to find the solution for your problem where you're comfortable because I want to give you your independence back and your power back. It's not that I'm taking your freedom away. You're making that decision for yourself, but I'm going to find the options and I'm going to let you decide because I think that's the problem that seniors think. Okay, well, someone's deciding because I'm everybody's burden. No, no, mom, no, dad. We are giving you the power to decide what you want to do.
Mhm.
That's what
Yep.
we
That aligns with our what we do at CareRight. We do customized aging plans. What might be the right aging in place solutions for Ethel and Marvin might not be the same solutions or make sense for, Tom and Tom and Ethel, so to speak. So that's, cuz in time in time when you're flying back and forth all the time with this emergency airfare, it's going to impact your business and your relationship. And so that's why we always try to get families to say, let's put an actual strategy and a plan in place, just like what you've done with the transportation piece. You're having same day surgery. Let's make sure you can get home safely
that's
and situated safely at home. So as far as like your business model. So if Harry has torn meniscus surgery repair and he hires your company to pick him up at the hospital, the same day surgery clinic, and then he's got to go to the pharmacy to get his pain pills. You do all of that process and then get him home and get him situated, right?
Let's back up a little bit, Annalie. It's more than that. It's almost what you guys do as well. We create a plan. Of course, yours is more of a long-term plan. Ours is a temporary plan, but it's still a plan that ride shares do not do because you're not talking to someone. So with Amera, you're talking to someone that we're bringing back that touch of voice of I understand.
Yeah.
You know, tell me what
Yeah.
you would like. How would you see this planned out if you had the ability to decide every step? So we want to be compassionate and say, okay, Annalisa, you're having a procedure. When is the procedure? Or do you stay by yourself? Are you alone? And then give them the option. Do you want to drive yourself? And then you want us to drive you back, even though you're going to have to figure out how to get your car back. But we're giving you that option. Do you want us to sit in the lobby? What about medication afterwards? Do you want us to drive by the pharmacy and pick up the medication? And so what makes Amera different is that we are coordinating not just with the patient, by their will, but with the facility. Because guess what?
Yeah.
It's all of us working together before and after. So now we're calling the facility. How long does Annalee have? What is her recuperation time? Maybe 15 minutes, maybe 45 minutes. Can you give us something that's going to help us? Because the truth of the matter is we're bringing down liability and bringing safety first with a lot of
Mhm.
compassion.
Right.
So what we do is when we pick you up, we're holding your things and we're saying, how do you feel? Because 10 to 15% of those, patients that go under anesthesia and come back out might have complications. That's a very small number,
Mhm.
but you know what? We're going to make sure we cover that risk by making sure that we're listening to you, we're talking to you. How do you feel? Do you feel dizzy? Did your blood pressure spike up? Why is that important? Number one, because we are trying to be there for you and understand that you're not by yourself. We're listening, we're caring. Number two is we're calling Amera and we're saying, hey, so when we picked up Annalee, she was very groggy. I don't think it's safe for her to stay home by herself. And so Amera calls the facility and the facility says, bring her back. And then they find out blood pressure
Mhm.
spiked up in the car. You don't want to leave someone with blood pressure at home.
Right.
You
Yeah.
don't want to leave someone by themselves who says, I feel good, but they're confused. And then they get up and then they fall, right? Fall risk. So that 10 to
Yeah.
15% is what we're covering by working together versus you getting an Uber. Guess what? The
Mhm.
Uber's going to just tell you through the app, I'm here. They're not going to get out of the
Mhm.
car. They're not going to look for you. They're not going to sign you out. Signing you out means that the liability of the facility passes down to the driver, who is the CNA or the nurse. So we are compassionate
Mhm.
nurse drivers. That's who we are. That's what makes us.
Sure.
The doctor feels good to know that Annalee came with us versus she took a taxi. It's just how
Right.
it is. So it's working together with compassion, with understanding, giving you your opportunity to you decide, is it a one way? Is it a round trip? Do you want us to stay? Do you want us to go? And following up after and saying, how do you feel? You know how many people today
Mhm.
don't have that? The fact that if you
Right.
read our reviews at Amera, it will tell you everybody was involved. And you see, that's what's important. Everybody being involved makes a decision much better for the person. And guess what? They recuperate better. And then they have that peace
That's
of
right.
mind. Hey, guess what? I didn't call anybody. I made that decision and I'm still taking care of my own self independently. That's the word that seniors and people that have to undergo a procedure, that's what they want. The word is there. Let me make my decision. When I was in New York, I told my dad, would you be
Right.
opposed to nursing home? And he almost cursed me out. He said, why would you make that decision
Yeah.
and not me? I said, oh my God, I should have known better. Me being a CEO of a company that gives people their independence back, I just took it away from my father. And I realized that I was wrong. And I said, I just took my dad. My dad has been a hardworking man all his life. And here comes his daughter very quickly. He said, maybe you should go to a nursing home. And I spooked the man out instead of saying, Dad, what do you want to do?
Mhm.
What would you like to
Yeah.
do? Don't worry about anything else. We'll figure it out. We'll find the resources. We'll get the right consultants. If we have to call Care Right, we'll call Care Right. I'm sure that if I don't have the answers, they do. But what do you want, Dad?
Yes.
Right?
Yeah. Yeah. So I love your business. I love, like I said at the top of the podcast, I love innovative business ideas and business owners because we have such a massive gap. Like, what we work with primarily seniors and their family caregivers, their adult kids or vulnerable adults who have like MS or ALS or a chronic disease or have cancer. And so that's who we serve with putting an aging plan or a care plan in place so that they have enough care in place and enough supports and the family doesn't get burned out as a caregiver and mom and dad are as safe and happy as possible. You have to put a plan in place to do that. And so I love finding um, creative business owners that have solved a problem that is everywhere. Like your company is just like mine. We work with families literally all across the country. And so you've created also a national company that serves the same day surgery transportation gap. How would people, if they want to learn more about you or your services in closing, how would they contact you or what's the best way to learn more about your company?
Absolutely. So our website is simple, myamera.com. And you have options on getting a hold of us. You could call us, you can email us, you could live chat. We have an app as well that we're going to launch. There's many ways. We want to give everyone the option of finding us any way they want to. Some people want to talk to a live rep. Some people want to just live
Yeah,
chat and here it is. This is my reservation that I want you to put together. And some people just want email. We want to make it because we do have family members who do that for their loved one. So they're busy like me. I want the app. Bam,
right.
bam, bam. Here it is. Here it is. I'm done. Or there's the person who wants to make the phone call for themselves. So phone call, email, or live chat to
Perfect.
myamera.com.
Excellent. Excellent. I love it. I love it. I I so appreciate you taking the time because I know I know we are very, very busy people as business owners. And I just wanted to say thank you for all that you do and all the successes that you have had in your life. I know we didn't get a chance to go into more of your background, but I just wanted to make sure that the listeners and the viewers of the podcast got the meat of what you do and how to contact you if this is a service that they need for themselves or someone that they know or love.
Absolutely. I appreciate you having me. Thank you so much. I'm
So
looking
very
part of the community of your database just to help everyone who needs it. So I appreciate the opportunity too.
very good. Thank you so much. And everybody who's listened to the podcast, please like and share it. And subscribe to our YouTube channel and spread the word. That's how we've all got interconnected is spreading the word about valuable services and resources for families across the country. Excellent. Thank you so much.
You're very welcome. Thank